Welcome to MedLab Insights. Today, we're diving into the world of cardiac markers through multiple choice questions. These MCQs are not only beneficial for competitive exams, but also for anyone interested in mastering the topic. So, let's enhance our knowledge and skills together in the realm of cardiology. Stay tuned. Here is the first question. The presence of which of the following isoenzyme indicates acute myocardial damage? Options are A. CKMB, B. CKBB, C. CKMM, D. All of the above. And the answer is option A, that is CKMB. Of the three isoenzymes of creatine kinase, CKMB is associated with cardiac diseases. For more details, you can refer to my previous video about cardiac markers. Next question. A common cause of falsely elevated LD1 isoenzyme is, options are A. Drug toxicity, B. Muscle injury, C. Renal failure, D. Specimen hemolysis. The answer is option D. Specimen hemolysis. Since LD1 isoenzyme is predominantly present in RBC, hemolysis can lead to a false elevation in LD1 isoenzyme level. Third question. The first enzyme to be elevated after myocardial infarction is option A, LDH, option B, AST, option C, CK, option D, ALT. The answer is option C, creatine kinase. The level of creatine kinase starts to elevate in 3 to 6 hours after myocardial infarction. Next question. From the below illustration, what is the most likely interpretation of LDH isoenzyme? Options are A. Acute myocardial infarction, B. Pancreatitis, C. Nephrotic syndrome, D. Viral hepatitis. The answer is option D. Viral hepatitis. Elevation of LDH5 isoenzyme indicates diseases associated with the liver. Next, question number 5. Isoenzyme assays are performed to improve option A, accuracy, option B, precision, option C, specificity, option D, sensitivity. The answer is option C, specificity. Next question. Normal creatine kinase level present in which of the following conditions? Options are A, myocardial infarction, B, brain tumor, C, muscular dystrophy, D, hepatitis. The answer is option D. Hepatitis. CK isoenzymes are present in the heart, brain, and muscles. So disease associated with the liver does not affect creatine kinase levels. Next, question number 7. Which cardiac marker is considered the gold standard for diagnosing acute myocardial infarction? Option A, CKMB. Option B, troponin I. Option C, myoglobin. Option D, B-type natriuretic peptide. The answer is option B, troponin. Troponin is a protein found exclusively in cardiac muscle cells. When there's damage to the heart muscle, such as during a myocardial infarction, troponin is released into the bloodstream. This cardiac specificity makes it an ideal marker for heart-related issues. They are highly sensitive and can identify myocardial infarctions that might be missed by other markers. Next, question number 8. Elevated levels of B-type natriuretic peptide are indicative of option A, acute myocardial infarction, option B, heart failure, option C, aortic dissection, option D, pulmonary embolism. The answer is option B, heart failure. B-type natriuretic peptide is a biomarker released by the heart in response to increased pressure and stretching of the heart muscle, which are common features of heart failure. Monitoring BNP levels helps in diagnosing heart failure, assessing its severity, guiding treatment, and predicting outcomes. It plays a crucial role in the management of heart failure patients. Next question. elevated levels of which cardiac markers are typically seen within 3 to 6 hours after the onset of myocardial infarction and return to normal within 24 to 48 hours? Options are A. Troponin, B. Myoglobin, C. CK-MB, D. BNP. Answer is option B, myoglobin. Myoglobin is a protein found in heart and skeletal muscle. It is a less specific marker compared to troponin, but it can rise rapidly after a heart attack, typically within 3 to 6 hours. Myoglobin levels return to normal relatively quickly, often within 12 to 24 hours. The last question. Question number 10. Which cardiac marker is useful in diagnosing pericarditis and myocarditis? Options are A. ProBNP, B. CK-MB, C. Myoglobin, D. Cardiac troponin. The answer is option D, cardiac troponin. Cardiac troponin levels can be elevated in both myocarditis and pericarditis due to cardiac muscle involvement or injury. The context of other clinical findings is essential for a more accurate diagnosis and appropriate management of these conditions. As we wrap up our exploration of cardiac markers and MCQs, I hope you found this video informative. If you did, please remember to share, like, and subscribe to our channel for more engaging content. Your support fuels our passion for spreading knowledge. Until next time, keep learning and growing.